Dear colleagues, good day. Thank you for the opportunity to present. I should say that AI in healthcare is probably one of the most controversial, because we're talking about human life. We're talking about the risk to damage the health of our patients. So the risk should be considered specifically, carefully. So now I would like to talk about liabilities and responsibilities when it comes to AI and healthcare. I would like to first and foremost say that software for healthcare is applied almost everywhere. Very broadly, I don't think that there is any medical establishment that does not use diagnostics software. But nevertheless, we're saying that there are many facts registered when certain malfunctions of software in healthcare led to various unfortunate incidents. And there's even stats saying that malfunction of hardware can lead to fatal results. So that's why legislators in many countries introduced regulations, procedures. It is impossible to introduce to the market some software for healthcare without preliminary trials and a careful procedure for registration. Same for Russia, by the way. Therefore, when we're speaking about liabilities and responsibilities, the first threshold is whether the software that has been registered is used as it is said in the registration statement or not. So if we see that the software has not been registered or used not according to the way it has been registered, of course, that is a violation. And the developer will be liable. If the developer introduced to the market the low-quality products that led to health damage, even in Russia, we actually assume criminal liability. But it's much harder to evaluate the situation when the software has been correctly tested, registered correctly, used correctly, and that still led to a unfortunate incident. That is a situation when it's much harder to establish who and why is responsible. There are many ways why there might be negative consequences to health. That may be the negative source of data, a wrong approach to training of the model, a wrong application of the model, etc. Specifically, in the healthcare, there are more and more algorithms that are assumed to be self-trained, and that models are trained when they're being used, and that makes things even more complicated because the model is trained based on data, and the training based on the real-life data may lead to malfunctions. More often than not, they're saying that the producers of the software, the developers of the software, are liable. But the developers are saying, okay, if legally I have to register my piece of software and provide accordingly some expertise, if I, as a developer, has done everything according to the rules and regulations. Why should I then be responsible? Maybe the legal body that was inspecting my software should be in charge, should be liable. But then the investigating body, the registrating body, cannot confirm that it completely avoid all of the possible risks. So they again finger point to the end user, meaning the doctor who uses the software. But the doctor can again argue that the doctor should not be responsible for his mistakes, in addition for software errors, in addition to his mistakes. So that leads to the fact when doctors simply reject software whatsoever instead of using it, because they are just anxious that they will be liable for certain mishaps of software as well, not only their own errors.